that was available for their families in segregated neighborhoods of Brunswick, Georgia, to the South Bronx in New York City, where I grew up. Yet, all except one of my parents and grandparents were dead before I turned 30. Some might point to my father's overweight frame or his high blood pressure as the comorbidities that shortened his life. These factors certainly were not irrelevant, but the resounding message of this book is that structural inequality, not individual deficits, was the primary factor that contributed to my father's death. More precisely, I aim to show that structural racism, which is the structural inequality that results from racial discrimination, was the primary cause of my father's early demise. But my father wasn't the only casualty of structural racism. The same racism caused the early deaths of most of my father's relatives and all my father's friends that I knew growing up. Some researchers estimate that up to 25% of deaths annually are directly attributable to income inequality. The best estimate is that structural inequality accounts for more American deaths each year than does diabetes or the flu. In 2000, an estimated 119,000 American lives were lost because of income inequality. Afflictions of structural inequality: poverty, prejudice, and poor health. Coming up, I will disabuse the fallacious notion that my father's genetics, indeed, that any individual's biological comorbidities, are the most important contributors to the disproportionately high morbidity and mortality that poor and minority populations suffer in America. I will recount the evidence showing that, instead, the systemically inequitable social comorbidities that our nation tolerates are the primary drivers of these disparities. Epidemiologists define comorbidity as the different conditions present that adversely affect a population's health outcomes. In this book, I explain the most dangerous and deadly comorbidity of all: structural inequality, and how it does deadly damage to the lives of all Americans. By structural inequality, I mean the deliberately and unintentionally constructed disruptions that a society uses to systematically displace humans from standing on equal footing in life. This inequality is structural because it operates through enduring societal institutions to regulate some groups to an inferior status and elevate other groups to superiority solely because of their group membership and without regard to their individuality or shared humanity. Structural inequality organizes preferential treatment on a large enough scale and powerful enough scope so as to operate as a virtually inexorable guarantee of predictably stratified social outcomes that reflect predetermined hierarchies, often for generations. In America, structural inequality sorts people by numerous metrics. This book is concerned with structural inequality based on socioeconomic status and race. Not only did this structural inequality contribute to my father's poor health and kill him before his time, but it is also killing the American dream for us all. Structural inequality works in at least two ways. Let's examine them. First, it perpetuates prejudice. It separates and isolates Americans by caste, concentrating enmity and poverty among us. In other words, place matters. The geographic location where and near where people reside significantly influences how they think and feel about